Good morning. I've got Ed Harrison and Bernard Harris with Pikes Peak Strategic Group, and today I want to ask some questions about discount medical plans and how that pertains to seniors. So, good morning, Ed.
Good morning, Dan.
Hey,
Happy
what do
to
you?
be with you this morning.
I'm glad you could make it. I'm glad you got some time.
And we're very excited about being here. We're going to talk about dental for seniors this morning, correct?
Yeah, if we could, I just wanted to know, dental. You got dental insurance and you've got dental discount plans, and then how those two pertain to seniors. What can you say about that?
Well, in particular, when we're talking about our senior population, that's pretty much that can go from 62 to 62 years of age and older. But we're really targeting is our senior population at age of 65 and above, because at that point, like myself, I qualify for Medicare. So I'm entitled to have Medicare along with my supplemental insurance program. But a lot of seniors do not realize that Medicare does not include dental nor vision. They more than likely will have a prescription program they can choose through their Medicare or supplement health plan, but dental is not a part of the Medicare program for seniors 65 and older. And as we know, as we age, we will continue to have problems with our teeth, unfortunately, and with the price of dentures. Some of our lower income seniors many times cannot afford dental services, so they sort of put it on the back burner, and when they do decide to go to the dentist, they'll find that the bills are a lot larger than what they could have been. So we emphasize our discount dental program, which is now our $4 family program, which Ameriplan is promoting this month. And so the dental in particular, Dan, with the denture program and the preventive with our family program for seniors is just an outstanding way for our seniors to get good dental care.
So did you mention dentures?
Yes, I did.
Is that covered under discount dental plans?
Yes, it is. And
That's surprising.
yeah, many times with basic dental insurance, that may or may not be covered. We know for a fact that adult dental adult braces are not covered under regular dental insurance, but under our discount program they are covered. So I run into more and more seniors at my local churches and around the city who are looking for a quality program that helps save their family, whether it's a single person or a couple. They're looking to save money because as you get into your later years, you're more than likely on a fixed income, and you're looking
Yeah.
to save every dollar you can. So that's where Ameriplan's discount dental program can really assist our fellow senior citizens. So we really are trying to educate them on our particular program, Dan.
That's interesting. Bernard, Ed said something about covering discount dental plans covering expensive items like braces for adults and dentures. That's kind of interesting because I know my insurance is pretty light. It doesn't cover anything near that kind of expense. What?
Well, what I'd add to that is what a lot of seniors seem to forget or either really don't understand is that under Medicare, Medicare only covers 80% of their medical expenditures, and they are totally responsible for 20% of that bill. And to add to that equation, their Medicare coverage does not cover dental or vision at all. And when you think about the expensive cost of dentures, and we did some research, on average, an office visit fee for complete denture upper is $1,889. And with the Ameriplan Corporation, it's $625, and that's a 67% savings. That is incredible.
Yeah, that's a huge savings there. And you know, those kind of expenses sometimes are a big surprise when you go into the dentist. He says, "Oh, by the way, you know, your teeth look pretty good except for this one back here. We need an $1,800 procedure." So, if you, what if you sign up for your discount dental plan when you've already got the problem with your teeth? Is there a waiting period to go through?
Absolutely not. In fact, a senior can join our program, as Ed said today, get their membership number today, and use the services today.
Today.
That's how incredible the Ameriplan Corporation is. And Ed also had mentioned, and we want to make sure it really sets in, that they can join today at a discounted rate. You're going to hear that word a lot, for $4 a month for 3 months, and then it goes to $8 for 3 months, 12 for 3, 16 for 3, and then it goes back to its normal price. Case in point, April of 2015. But at the same time, you're benefiting from being in our plan.
So you could definitely save thousands of dollars over just a few days with the plan.
Exactly. In fact, if a senior citizen were to get dentures today, the program would have paid for itself for the next 3 or 4 years when you consider the price of what dentures actually cost, and you're going to get those same high quality dentures had you had to pay out of pocket. This is what's so incredible about our program.
Well, that's interesting. Ed,
Yes, Dan.
so just after what Bernard said about the savings, my first thought would be you'd have to go see a cut rate dentist, and there's probably not too many providers for that at the at the savings.
Oh, no, that's not true. We have over 30,000 qualified dentists throughout the country. In our large cities in particular, I'm close to Phoenix as well as Tucson. Tucson closer. We have a number of certified dentists. When I talk about certification, these men and women are certified through the state, through the local state. They're qualified to do a variety of dental procedures. Of course, they are well educated and have to do all their updates. They are contracted through the Ameriplan Corporation. People either can use our 1-800 number or go on our website, and they can choose the dentist who they feel most comfortable with. Many times when I'm talking with prospective memberships, the first question I get a lot, Dan, was my dentist on the program. So,
Yeah.
and that could be yes or no. So we take an opportunity through our website to see if he or she's on our program. If they're not, that particular prospective member can go to their dentist and ask and request through that dental office that they apply to be a part of Ameriplan's program. So it's not that, of course, we can't have every dentist is not going to be a part of our program, and that's his or her choice. But that particular patient of Dr. Jones, if you, like I said, they can apply to Ameriplan Corporation outside Dallas, Texas, at our corporate office on becoming a dental provider that's a specialist as well as a generalist. So we're always looking for more qualified dentists to provide our customers.
So I know we didn't discuss this earlier, but so say if I've signed up for Medicare or I'm on the Affordable Care Act, and I'm assuming that my dental is covered. Is that not true?
No, it is not. They
No?
are not covered for dental and vision. That's a very critical point that seniors need to understand. It's a shock to a lot of people when they find out what they don't get, and when they actually get a bill for services rendered at a hospital. But to round out your medical care, every citizen, every senior absolutely needs this incredible program.
I was reading through the website a little bit, and I stumbled across the patient advocate thing. Can you explain that a little bit about a patient advocate that Ameriplan can provide?
Oh, absolutely. The patient advocate program it comes through the CARES group, and each member family or family group or household group rather will get a patient advocate, one that is capable of speaking their language, their native tongue, for lack of a better term, and will help them consolidate bills into one bill that fits their budget. And you can use this service over and over again. And what they essentially do is take all of your medical bills, put them into one bill, and then you make a payment once a month until the entire bill is satisfied. You can still use your services over and over again, and they continuously go back and combine all those payments into one. What you would pay would be different from what Ed would pay or what I would pay. It depends on the funds coming into your household.
So, if I'm to understand this correct, that you will have an advocate, I mean, somebody by name that will be working with you and that will actually communicate with you on some of these things?
That's true. That advocate will stay with you through one or two events, as long as you're in the program and as long as that advocate is an employee with the CARES group. And they're going to, again, have you get all of your bills with that particular medical event, and then they will be the point of contact with the doctor, the anesthesiologist, and the hospital to get you one bill. Case in point, a lot of folks never look at their medical bill, and if you take a close look, you'll find where you might have an aspirin that costs $7.95.
Yes.
This is not something that you make up. I'm specifically talking about my wife's open heart surgery. One aspirin, $7.95, and you'll see that throughout the bill. The CARES group is going to help alleviate that, and the hospital still makes money, and you're not going into the poorhouse.
That sounds great. I don't think there's any medical insurance that actually does that for you. It sounds like the discount medical plans are really what you need to have.
Absolutely.
So, Ed, I had another question for you about cosmetic dentistry. I mean, that can't be covered, can it?
Oh yes. Well, cosmetic dentistry is a part of our Ameriplan discount program. That is a specialist. That is a specialty, and I like to talk to our individuals members who are looking for cosmetic surgery, because in some communities we may not have the specialized dental person that can handle them, but in most of our large cities there are, whether it's Colorado Springs, Phoenix, Tucson, LA, New York, you're going to find these individuals who specialize in cosmetic dentistry. You might not in rural Iowa or rural Nebraska, where I was born, but you can find that in the bigger cities. So when I get prospective members or customers who are speaking about that, I will sit down with them, get their information and their zip codes, and let's look up in their area and see if we have professionals in that area that can handle their services. Because the last thing we want to do as part of the Pikes Peak Strategic Group and Ameriplan is market and sell a product to an individual that they really can't use at that particular time if they're 100 miles away. But if we are fortunate enough to, and some people, if they can find the right dentist, they're willing to go into the largest city once a month, maybe for some, if they're going into LA or rural Iowa, and work with that dentist if they like he or she. So there's a possibility. But we like to give people choices of what our products can offer, where we try to be as honest as possible and give people quality service at a low price.
And it sounds like if you go to pikespeakstrategicgroup.com, you can actually go to a page there, maybe a frequently asked questions page, and I think you can go to a link that you can search for doctors. Is that or dentists? Is that true?
Yes, that is, Dan, and we're very proud of that. And the Ameriplan Corporation, their particular, they have a special a group there that works in the office, and their sole job is trying to bring on new specialists, whether it's the dental area, the vision area. They're always looking. They're out there in large and small cities looking to bring in new doctors and other providers that we can have, to add to the website that will help our prospective customers. So that's an excellent point, Dan. It's going to the pikespeakstrategic.com website, and also our 1-800 numbers. They're available also.
So Bernard, so the discount dental plan, say if I were to sign up, it covers me and I've got to pay for every single member in the family?
No, that one price covers all, and then when you or anybody in your household, we want to make sure we get that terminology correct, not family members, individuals are part of your household are also covered. So big distinction between us in Ameriplan and traditional insurance. Traditional insurance only covers family members if you list them. With the Ameriplan Corporation, individuals in your household can take part in that program. And another excellent nugget to point out, as you travel across our great nation, you can use those services, the family dental plan, in 44 of the 50 states. And the reason the 6 states that you can't use are very sparsely populated states: Alaska, Montana, North South Dakota, Wyoming, and Vermont. And these are just laws that were set up by either that state or with the Ameriplan Corporation. But we're still batting at over 80%.
Well, that's amazing. So it sounds like the discount dental plans are portable, is what you're saying.
Oh my God, yes.
Okay, that's a good thing if I'm a senior citizen and I want to travel a little bit. I don't have to worry about staying at home with my dentist.
And that's very, very true in that a lot of seniors postpone their travel until they're seniors, and with us they can take advantage of our incredible programs from coast to coast. And this is what is so great about our plan. Incredible.
So what you do is you take away the worry and the concern, is what I'm hearing.
Yes. Also, what we're doing is allowing seniors who are just as adept at using a computer, they say, well, we're going to travel here. If I want to get my teeth cleaned, if I want to get braces, which are not covered by traditional insurance, Ameriplan is going to give you a 63% deduction in the price that you pay for adult braces. And a lot of folks are very keen about their appearance. Let us help you do that.
Well, that is truly huge. 63% discount is a lot of money.
A whole lot of money.
That's a good thing. Well, Ed, you guys have really filled up, answered a lot of questions here for me. I really appreciate you taking the time to talk a little bit about discount dental plans and how they pertain to seniors.
Well, hey, Dan, it's always a pleasure to be with you and talk about and educate our fellow Americans about what we can do at the Ameriplan Corporation and the Pikes Peak Strategic Group to help people save money. And that's the bottom line these days. Things are tough, budgets are tight for families, and we're here to, once again, educate people on how they can save money on their dental services. So if we can touch a few people each and every week, that's what we're here to do, Dan.
I think that's a big help. Now, if we wanted to go to the website, what's the website name?
Pikes Peak. Go ahead, Bernard. Oh, Pike Peaks. Pikes. www.pikespeakstrategicgroup.com. That's www.pikespeakstrategic. group.com. Also, our 1-800 number is there. As I recall, we also have that on a link there. So we encourage people to come to our website. If they have questions, please give us a call. You will get probably either Bernard and I will respond to your calls immediately. And we just look forward to once again, helping our fellow Americans across the country.
Well, that's fantastic. I appreciate the time, and I'm going to make sure that there are links to that website and the phone number below the video, too. So, gentlemen, I appreciate your time today, and this is a great informational video here.
Well, thank you, Dan, for moderating. You always do an
My pleasure.
Bernard and Ed, you guys have a fantastic day.
Okay.